I'd like to start off by acknowledging the people and the land on whose land we meet. This is a subject that's really quite dear to my own heart. It's about what data is already held under Indigenous control and the extent to which we're currently able to make use of that, and if we're not able to make use of it, what are the barriers, how can we address those barriers in this age where everybody is talking about the importance of large-scale databases and data sharing and data exposure and so on. And so I think it might be an idea for us to get a bit of context if I ask each of the panellists to tell us a bit about their background and how they relate to this topic. So,
shall I start?
Yeah, we start.
Yama, everyone. My name is Nikki Moodie. I'm a descendant from the Gomeroi Nation on my mother's side and Scottish on my father's side. I am a very newly minted researcher, and my background is sociology and political science. I currently call education my home. And my current projects include an analysis of the data discourses used in Indigenous education policy. I know education hasn't kind of come up a lot today, but I'm interested in both the ways in which the very problematic discourses of data, such as we're all very familiar with what's used in the Closing the Gap policies, but the way in which those data, particularly as they relate to education, are used inconsistently and wholly conceived within a deficit discourse. My stock and trade, I guess, is policy analysis. I'm interested in a lot of the comments that people here today have been making about the failures of policy analysis and how we can do that better. But as Len indicated, I'm interested in the way in which the data that we already have is not used well. You want to talk about underutilisation of data? Let's talk about data sovereignty over NAPLAN. Let's talk about data sovereignty over the educational psychologists who are collecting data about Aboriginal children in schools. Let's talk about data sovereignty over the behaviour management plans that teachers are using in primary and secondary schools across Australia. So when it comes to data sovereignty, I'm conscious that there are a great deal of very well-developed projects in the health and medical sciences, but I guess here today I'm kind of sticking a little bit of a lone hand up for a critical look at education. That's me.
Kia ora hui mai koutou. My name's Andrew Sporle. I'm a Ngāti Apa and Rangatane man from the North Island of New Zealand. I originally started off in research because one auntie told me I needed to apply for a job at our equivalent of the NHMRC. I got that job. It was the first manager of Māori health research at our Health Research Council of New Zealand. I didn't like it very much, but what we were able to do there was implement a rapid workforce development program that has since produced over 70 PhDs from pretty much nothing. We have also changed the way research is funded to make government-funded research actually have to articulate how it is responsive to Māori and Māori development. My interests, I'm a sociologist pretending to do epidemiology but hiding out in the stats department.
Brave.
Yeah, very brave, especially this stats department. It's the largest in the world, one of the largest in the world. We have over 7,500 students take our Stage 1 course alone. Hugely well resourced, the home of R. My current work is mainly in the official statistics space, but where I'm working at the moment is doing some really cool stuff, working with communities to co-create material that then is adjunct to what is in the official statistics system. I'm also interested in helping communities extract whatever they can out of the official statistics system as quickly and as cheaply as possible. So that's my background.
Yeah, I think probably people do know me, but I'll just go and say what I've done and what I'm doing. I'm an epidemiologist, and particularly in children and young people's outcomes. So I've been involved in both data collection, setting up registers. A really a big commitment in the end of the 80s was thalidomide and Agent Orange. Probably half of you don't young people don't know what these things are, but anyway, and setting up registers of disease in a total population to enable them to be linked into perinatal and other data sets. And so record linkage has been very important for me. And I've always had the absolutely convinced that data is powerful. It's just how you use it. And so it's been a very important thing for me that we advocate powerfully using data, and that I would never, I think, advocate unless I had something that was going to really back me up very strongly about the evidence, like the evidence I told you about the impact of stolen generation. And also the other thing we have been committed to in our institute for the last 30 years has been the training and mentoring of an Aboriginal research capacity, and that's been extraordinarily successful, and I'm really, really pleased about that. My current work is in the University of Melbourne anyway, is about the Australian National Development Index project, which is a project, a part of the OECD global project, the groups of economists like Joe Stiglitz, Amartya Sen and so on, who want to go beyond GDP as our sole measure of the progress of societies, and that we have to bring in other things like well-being, for example, and how we feel about ourselves and health and other things. So I'm very excited about that project. It's going to be long and complex. It's about enabling democracy because we'll have to have a community conversation like you. This is why I love these models today. Community conversations about what you really value and how can we measure those. So big project, but I'm really excited about it. Thank you.
Hi, I'm Sara Hudson, as was mentioned before, and I work for the Centre for Independent Studies, which is a think tank. And I've done some research recently on Indigenous programs and funding and evaluation of Indigenous programs, or rather the lack of evaluations of Indigenous programs. And I think one of the most concerning things for me when I did that research was actually not the lack of evaluation so much, but the fact, and this sort of follows on from what was said in the previous session, is that even when evaluations have been done, the government's not using the evaluations to inform funding decisions. So there was an audit of the New South Wales government, and they found that none of the evaluations that they've been doing have actually been fed back into funding decisions. So my concern is that if we're going to collect data, we're going to go through the problem of actually asking people to give information, that we're actually going to use that data in a responsible way. And so the research that I was doing, I think you might have seen some of the report that was sent around here, was to look at self-evaluation and actually moving away from evaluation as an audit sort of tick box exercise to learning and development, looking at evaluation as a learning and development process. Because I think there's no point in having this rigorous evaluation methodology if no one's actually using the evaluation, and that you're actually much better off having a feedback mechanisms and feedback loops, which I'll talk about a bit later. So it's when you collect the data, you're doing it in a way that you can actually feed back to the program funder about what changes need to be made to the program to make it better. Much better off having those kind of mechanisms than a really, random control trial, supposedly rigorous process of evaluation. Thanks.
Hi, I'm Lisa Strelein from AIATSIS. I am a fourth generation Australian. On both my mother's and father's side, they came out here in the 1830s and 40s, and have a history of relationships with Indigenous communities and family Indigenous communities over that time on both the New South Wales coasts and southwest coast. Despite all that, I ended up doing a commerce and a law degree. So that's my training background. And ended up in Indigenous research and working at AIATSIS, and have participated in some really interesting research projects, through to designing research programs, through to being involved in research policy, but also looking very carefully at the impact that research can have on policy and outcomes for Indigenous peoples. I'm not a data guru or a data geek, but I am involved in some relatively big data projects. I'm a CI on the Maikwai longitudinal study. We're just in the process of designing the 3rd National Indigenous Languages Survey, and we're just about to undertake the 2nd National PBC Capability Survey. So I have a genuine interest in how the governance of those projects is managed, but also how organisations decide what projects to do. I've also been involved in the AIATSIS ethics program since its at very earliest days. One of my first jobs at AIATSIS was to write the guidelines for ethical research in Indigenous studies, and it was the first time a human rights approach had ever been applied to the concept of ethics and research with Indigenous communities. So that's something I'm very proud of. It's coming up for its 20th anniversary next year, and we'll be looking at reviewing those guidelines next year. I've also been involved in the AIATSIS is one of a small group of what's called the publicly funded research agencies, which includes the big funding bodies, but also smaller agencies that are very much like AIATSIS, like CSIRO, the Australian Nuclear Technology Science Organisation, the Australian Maritime and Science Organisation. So all these big science organisations that we're a tiny little social science organisation in, which has been a very interesting experience. So they're the kind of, I guess, experiences that I hope to bring to the discussion today. Some of you know my strongest research background is in the native title area, particularly looking at the limits and constraints of that legislative program and how we can decolonise some of those arrangements. So I will hope to bring some of that learning to the discussion.
Afternoon, John Paterson, Chief Executive, Aboriginal Medical Services Alliance, Northern Territory. My affiliation with country and tribe is with the Nullaghan tribe in the southeast Arnhem Land region of the Northern Territory. Father, obviously with the surname Paterson, father's English and Scottish, so that's where he's from, migrated out to Queensland back in the day. I'm obviously born and bred in the Territory, did my university studies at Edith Cowan Uni in Western Australia, graduated with a Bachelor of Social Science and Human Service Management, have worked in the last 3 decades at Commonwealth, State, non-government, land council, senior levels of those organisations, so I think I come with a very broad background of experience and knowledge now, given that I've worked across those sectors of government and non-government organisations. 10 years just ticked over with being in the position as Chief Executive of AMSANT. I'm also a spokesperson for the Aboriginal Peak Organisations Northern Territory. As you appreciate and understand that the health sector is under enormous pressure at the moment to share and organisations, research institutions, governments, the new public health or primary health network organisations across the country are also wanting access to our data and statistics. So we're being inundated from all fronts. And I see as part of my job, it is to protect the data of each of our individual patients, particularly in the Northern Territory. That's part of the AMSANT membership. And we have a number of organisations, MIWACH, which Dr. Lucas is Chief Medical Advisor for, John Boffer, and I have a couple of other advisors, Dr. Liz Moore, an experienced GP also working for AMSANT. So, collectively we monitor, review, advocate and lobby to ensure that there are proper governance structures, approvals and endorsement for the use of data. In the Northern Territory, for those who aren't aware, we currently collect between the Northern Territory government-run clinics and the Aboriginal Community Control-run clinics. We have a set of data collection which we call the, the 19 KPIs? NT KPIs? We've increased it to include a couple of other key measurable items. Dr. Boffer and Lucas, you might be able to inform the meeting of what those 2 additional ones are. But we've been collecting them now for a number of, how many years, Boff? 10? Yeah, 13 years. So we've got a really rich repository of information pertaining to Aboriginal people in the Northern Territory that have given consent to release their data. It's de-identified, critical. If we're releasing information and data on individuals, it's got to be de-identified. It's got to be on a regional basis. And the way the 19 KPIs or the 21 KPIs now is reported back to AMSAND and our members and to Territory Health is by way of de-identified regional information. So we've broken the Territory up into how many HSDAs, Boff, Luca? 15. So we've broken the Northern Territory up into these 15 health service delivery areas, and they're all, that's how we de-identify the information on a broad range regional level. We're very careful and very selective in who we release that to, and it's our job, my job, to ensure that our members are across all those issues. Who's requesting, the data, develop policy positions on this, AMSAT member policy positions, so that if they're approached directly by, those that want to get access to their data, at least they're guided and in their organisations they have a position that they can inform those who might come knocking on the door to access that data, what the position is. We're willing to release, some data, but we want to ensure that there's good governance, good processes, good management. The last thing we want is data to be released and then we see misreported national headlines on, the Sydney Morning Herald or Herald Sun or the Australian newspapers, and just not reporting the right story. That's our fear. And besides, our constituents, our Aboriginal population, Northern Territory, have the trust in their locally run clinics to ensure that their records, their medical records, their data, their information is protected, and there's appropriate firewalls around so that it makes it difficult if there's going to be any intrusion or skullduggery going on to try and access that data, which we see from time to time internationally. That megadata stuff, that's scary stuff, And I mean, when I heard that people can actually, that the phone calls we have now on our mobiles, knowing that Big Brother's listening in, and at any time they can, radar in, it's pretty scary. So they're the sorts of stuff that we've got to ensure that we have good safeguards around, good protection, and there's good, open, transparent processes that protect that and govern it.
Well, thanks, John. It sounds like that's an example of a data set that it really is being well used and well looked after. I'm sure there are others that aren't, and perhaps I can just remind us of what the questions are that we're being asked to address today. It's the wealth and value of data in Indigenous sector that is not being used or is underutilised. What are the barriers and enables to access underutilisation of data? And what are the factors needed to address these issues pragmatically and usefully, and suggestions of how it can be managed within or for the sector? So I guess what we're looking for, and it's probably going to be equally from the panel and from the audience, is people's thoughts about what the data is that they're aware of and that they could use help to make use of and to sort of use for the benefit of their communities. But panellists, any sort of comments on that?
Sure.
Yeah,
Many.
thank you.
We're all looking at Nikki because she prepared earlier.
Because I was a little intimidated by the panel and by all of the amazing health and medical people here. So, I think when we come from education to these things, we're often viewed as a bit of a poor cousin. But I guess
Influence on health is education.
Well, would often, to address Len's question, I think I would often take the consistent application of the data that exists, before I even, talked about access. When we ran the analysis of how the states and territories apply the Closing the Gap headline indicators in education. So this is just a fairly classic case study of policy transfer and diffusion from the Commonwealth to the states. Not a particularly in-depth comparative study, but just to look at when the Commonwealth establishes those education targets under the Closing the Gap policy, how then do the states and territories take up each set? They're the ones that are collecting data, but do they incorporate it into their policy processes? Do they say that they're going to report on it? We know that every state and territory is collecting data on student attendance, and all of them are passionately interested in surveilling whether or not children are going to school, right? Because it's hooked into so many other social policies. But the early childhood education data is not a consistent part of education policies across the country. There are motherhood statements about increased retention everywhere. No matter where you look, it's all about retention. But Queensland is the only state that explicitly states it has a policy aim to close the gap in attainment, in Year 12 attainment. New South Wales is the only state that explicitly identifies any bilingual or language object in its education policy. And South Australia and Tasmania are the only states that have anything to say about professional development for non-Indigenous education workers. I'm not worried about Aboriginal teachers, but to that end, New South Wales Catholic Ed Office has only recently amended their HR forms to include an identification box, right? So New South Wales Catholic Ed didn't know how many Aboriginal teachers were working for them until 2 years ago. So it's not, this isn't rocket science, the consistent application of the data that they have already said is important would be a good start. But that's even before we get to a discussion about, are we actually thinking about the things in schools, in curriculum, that you want teachers and principals and schools to collect data on? When it comes to language policy, and I'm far from a language policy, so I'm taking my advice from my Maori colleagues and others working in this space. You don't teach a kid who speaks French how to speak English by yelling at them in English, right? When it comes to teaching children who speak Aboriginal Englishes or Creoles as their first languages, no other country in the world would teach someone Australian Standard English by just yelling at them in English. So what is it that we actually want our curriculum to look like? What do you want curriculum to look like? What do you want Aboriginal children to be learning in school, and how do you want them to be taught? Because I can guarantee you that the data that teachers have right now is not moving towards that aim. But schools, education departments are collecting enormous amounts of data. It is absolutely huge. And I dare say that access is probably similar to what many of our colleagues here today have spoken about. So I guess this is my impassioned plea to perhaps, focus on the underutilisation of education data, but also to think about what is it that you actually, what do you want me to look at? What do you want me to look for when we're running policy analyses? Because we have to work from the basis that the anti-rationalism of political economy is pretty normal, right? But there are things that we can look for, there are things that we can do, and there are conversations that we can have around curriculum and pedagogy, testing, assessment, that will get closer to the strengthening of identity, the changing of curriculum, and the role of education institutions as part of that. So I'm going to stop talking now.
Thanks, Nikki. Other comments from the panel?
In terms of the wealth and value of the data, the starting point is that getting communities to define what they're interested in right, is the foundation for that wealth, right, and the value in the data. And I want to give you two stories from tribal nation stories in New Zealand. The first is about one of our first medical graduates who produced the first epidemiological study of any type in New Zealand. He was Māori, he was from the Taranaki region, which is the bit that's closest to you guys, okay? That little bump on the west coast, with a big volcano in the middle of it, because it's New Zealand, so it has to have a volcano. But anyway, that Te Rangihiroa and his descendants have produced a dean of a medical school, right? One of the top brain researchers on the planet, and one of the very few surgeons who has trained at the Sloan Kettering Cancer Surgical Hospital in New York, who declined a full-time permanent position there because he wanted to go home to country. And they were interested in fending off some government policy initiatives about their underachievement, right, in education. And they said, we have a history of very high success, right? Focus on what made that high success possible. Don't tell us about how bad all our other kids are. Tell us about the success paths. And what it was that there was a cancellation of the native education policy in the 1880s and 1890s that meant that in that area, the children stopped being taught professional path education. So what was unique about those kids is they're actually being educated off their own country. They're having to be sent away, right? And so that was an insightful for that population, to say we actually had to get out of our own country to succeed, and there were some partnerships with the church, but that were important in supporting that family. The second story is, so that was a way of turning around the dialogue that was coming from central government, and recognising the wealth and value. The second story has to do with a family on the other side of the North Island who had a hereditary form of stomach cancer. Youngest age of onset 12. Nobody made it past 55. One particular family, 12 siblings, 11 died of stomach cancer, and the 12th died because she got drunk at a funeral and walked in front of one of her siblings and got hit by a truck. So completely devastating. That was written up in 2 academic papers that were published in the 1960s, and nothing happened. In the 1990s, they followed up with one of the descendants from the other side of the island, who was the dean of the medical school, and said, who was a gastroenterologist, and said, we have this issue, we want something done about it. And so they formed a relationship I was lucky enough to broker between themselves and the top cancer genetics laboratory in New Zealand. Cancer geneticists had never worked with the Māori community before, didn't know how to do it. Māori community had never worked with a university before, didn't know how to do it. There were some issues, we managed to broker it. As a result, right, the cancer geneticists said, what we actually need is a really good kindred. And the Māori family went, we got you sorted. So we worked out a partnership, and that included the funding agency telling the university it's halvesies on all the intellectual property on this, folks. University said no, so the funding agency said no. University backed down, right? And then as a result of that really, really impressive genealogical information that the family were able to bring to the table, they found that gene within 6 months. They had 3 years of funding, right? So they had a bit of surplus funding. That gene has since been identified or similar gene fault has been the cause of that hereditary diffuse gastric cancer worldwide, and there's now over 450 kindreds developed, right? And it was all because the family were able to define an issue and engage with a funding agency and a university and do it their way, including owning half the intellectual property. It is possible, we just need to change the game.
Thank you.
Well, I'm
Fiona.
changing tack a bit, because the question that I'm sort of thinking here, wealth and value of data in Indigenous sectors not being used or underutilised. I guess there are several reasons why it's not being used or it's underutilised, and some of them are that we just don't know that the data's there, and there's lots of fantastic data sets probably out there. that we just don't know about. And I think it's up to if Aboriginal people want to find out about certain things, and these may be things outside the health area, letters, educational stuff, artefacts. I think there's ancestry stuff. There's probably lots of stuff that's been under research, and the difficulty with some of those, of course, is people don't know who they belong to, because there were so many things taken without people actually noting who they were taken from. So you can't actually, with the artefacts, for example, my daughter's a historian, so I've been briefed a bit on this. In the British Museum, they don't know actually who if you wanted to repatriate them, you wouldn't know where to take them, because they weren't actually recorded. Perhaps the area was recorded, but so there's a lot of stuff that you can't probably access, but it would be very exciting if we could access it in a way that was very productive. The second reason I think why people don't use data, or it's underutilised, is what I was referring to in relation to the Commonwealth, and it's territory and ownership. It's my data, and you're not going to use it, and that came out from all this morning's thing where, the people who own the data often will be, perhaps if we're doing with our data linkage, it's the agencies, the data custodians are actually the agencies, they're not the people. And so that kind of territory and ownership, we do a randomised control trial, we do a survey, it's our data, no one else can have it. And yet there's this whole policy at the moment of data sharing and opening up of data. Now that's going to be hugely positive for Aboriginal communities if they can get into it. How do you get into that if you're an Aboriginal community out there without the capacity, haven't got the terminology, haven't got the computers, haven't got the funds? How do you actually get into that? I think it's a big question that we need to answer. But that's going to be another reason that people are just going to hang on to things and not let you have them. And they may be doing that for very bad motives, that they don't want you to evaluate how hopeless their services are, for example, which is a question I gave, the thing I gave today. Yeah. So
thanks, Fiona. It occurs to me that, if we were thinking about any other field of data, what you would be saying is we need to do an inventory.
Yeah.
We need to have a resource which tells us what's in all the data all around, what data's all around the place and what's in it, And
we actually put that up to the Prime Minister in 2006 on Data for Science. We presented it at the PMSEC, and to have an inventory of what data are available across the nation. And I don't think it's really happened a lot. It's starting to happen, and I think that could work very well.
That's right, and specifically now with the federal government taking a sort of increased interest in data development for its own reasons, there's going to be resources to do that sort of thing, and I think that's one of the areas that maybe this group could be thinking about.
There's probably one. Oh,
sorry, you go, sorry. I was just going to follow on from what Fiona was saying. I couldn't agree more about definitely the government's reluctance to share data. And I'm talking data broadly, like evaluations. So there's lots of evaluations that have been done that are never made publicly available.
I wonder why.
Because they know that it's not going to paint them in a good light. And so when I identified that only, I think, 8% of evaluations had been, programs had been evaluated, that was only publicly available evaluations. I'm aware there's a lot more evaluations that I couldn't access. But I think that's part of the problem. If the evaluations have been done and that data should be publicly available if it's a government program. And the other thing I think is there's a big gap as well between the research that's done around, say, health interventions and then actually translating that research into health programs. So there's what they call, I guess, implementation science, and that's a big challenge is how do you actually have evidence-based policy? Everyone talks about the need for evidence-based policy, but it's actually really quite hard to do. And a lot of the research that's happening isn't necessarily being used by the policymakers.
Other comments?
Probably one of the biggest investments in Indigenous research over the last 25 years has been probably $1.5 billion spent on native title research across the country. So we know a lot about that research. We know a lot about that data. It is underutilised, particularly by the communities who own it. And I use own in the concept we were talking about this morning, which doesn't mean necessarily legally owned. There's a whole lot of legalities around how that material was collected in the process of litigation process that has made it not as simple a process as you would expect for native title holders to get hold of their data. And I'm trying to think of how we can get another moratorium so we can just release the data. why that data is interesting. It is not. It's not just that it is the stories and the heritage and the genealogies and the language material and the collation of material in collections around the world, but it's also the first time we have systematically addressed Indigenous peoples' systems of law and Indigenous peoples as societies as a whole. Basically, that was the project, to map the systems of law and custom and to define Indigenous society. So that is such a unique thing.
It's a fantastic comment, because in Western Australia they were going to shred all of the native welfare documents, and Margaret Metcalfe, who was head of the archive, stopped it, and those documents meant that the whole of the southwest Aboriginal land group could actually make their big native title a success.
Absolutely.
Of course, it was then knocked back by both state and federal governments. That's another story. But in fact, that wealth of information proved continuous connection to culture.
And even where, I mean, we know that native title is a very imperfect recognition of Indigenous people's sovereignty, but even where the native title process may not result in a positive determination, the research is still there, and it's still a resource for the community to use. The other, I guess, just interesting pieces of data that are out there are all of the magnificent material that's being collected by ranger programs around the country. So we have hundreds and hundreds of young people and old people employed working on country around across the continent and in the Torres Strait and all the islands that don't constitute the continent, you know, really fine-grained detail about where they're going, what they're doing when they're working on country. In 30, 40 years' time, that is heritage. That is, I know where my grandfather went, I know what he was doing, I know what he saw, there's photos of it. And then I guess the third one, which is probably more obvious, is, and we've already talked about the collections, but the Indigenous knowledge that's embedded in those collections. And we often think about things like language collections or photographic collections as collections of language and photographs, but they're also so much more. So if you think about what we can learn about climate change, for example, from looking back on country through archives and looking at what rangers are doing now, the connections we can make and the way that Indigenous knowledge can be better utilised in the management of our country, then I think there's, you know, some really big value statements in that idea of data that's not being utilised. The final one I would guess make a call for is the unrecorded knowledge that's at risk, and I don't want to fall into any traps of cultures that that are somehow not resilient, because we know they absolutely are and continue to be practiced every day. But every community that I know has old people that they would love to be able to ensure that their stories are recorded and able to be renewed and reused, and to basically, have a cultural resurgence within those communities. So I guess that's probably some big areas of data that we know are underutilised and potentially undervalued in terms of particularly policy research.
Yeah, I couldn't agree more, especially about the native title and land rights databases. That's just an amazing resource that sits there and used for very narrow purposes where it could be used for so much more. Speaking bureaucratically, I'd say, well, what we need to do is do a survey and establish priorities and find resources, okay?
So we've done that.
We haven't found the resources.
We're getting the resources.
Yeah.
It's interesting that it is the power of survey and the power of actually knowing the scale of the challenge is incredibly important. So we've been working on that issue through a particular project, managing information native title, working with government and communities to say, here's the priorities, this is why this stuff's important, don't leave it in boxes. And we're coming around to the recognition that that capability needs to be funded within those organisations.
The other area I'd mention that we haven't, I think, lit on is the legal services. I know nothing about their databases or what they do, but I have the impression that that's also a vastly underutilised resource.
I was just going to, I totally echo what Fiona referred to in terms of capacity. Look, for 95% of our members, research and data stuff is you know, the last thing on their minds. I mean, their main concern, day-to-day priority is to get those patients tended to, deal with the huge numbers that are coming in the door on a day-to-day basis, and getting on top of all those chronic illnesses which our patients rock up with on a daily, weekly basis. But the other, I see the need, and I don't know, it's great to hear that AIATSIS is doing some of that collection around native title and land rights and those sorts of things, but there are all those other areas you just mentioned. Legal services. I'm pretty confident with AIATSIS, the peak organisation. I know in the territory that whenever they're advocating for, you know, increased funding or whatever the request is, they tend to have really good data and statistics at their fingertips. So I'm confident that they've got some reasonably good process and structures, you know, that collect good data from their legal practices. The health sector I've referred to, but there are all those other things. You know, we're heavily involved from the Aboriginal peak organisations around housing. You know, the overcrowding housing situation in Northern Territory, and not just the Northern Territory, it's nationwide. Education, you know, the NAP plans, but there's all those other areas, you know, that I sometimes think and wonder whether, you know, there's a specific entity or repository or organisation or whatever it is that can take the initiative to start to collate some of that. And I think Pat Turner mentioned a little bit this morning when AIATSIS was around, at least that when AIATSIS was, and I was a former AIATSIS commissioner as well, we were able to, that they had a set of data collection and repositories within the organisation that we could, you know, at the bit of research and manipulating the systems, get some real hard evidence on, you know, the lack of housing or municipal services in a particular community, you know, lacking, what's there, what's not there, the level of funding that's going in there. That'd be great to have a place where you, at the push of a button, you know, pull up a community and there's all that, you know, basic information there. How many houses are there? How many people? What's the health service provider, you know? How many kids are at school, you know? So, and I think, I don't know, I blame governments, I'll have to blame them, for not being able to fund and resource the appropriate structures and agencies to be able to compile this sort of information, you know? It's all ad hoc at the moment.
It's very ad hoc.
Yeah. But through
unreliable, you know, 12 months old, maybe, you know, with the statistic, what are we finally getting, are we finally getting access to, what's year statistics now, the ABS stuff?
Yeah.
2000 and what?
2016.
16?
So we still haven't got some of the data from that.
Yeah. Surely.
But through all those changes, AIATSIS has continued, hasn't it?
That's right.
So
Still
we have to wonder, is AIATSIS the place where this sort of stuff
Well,
should be?
well, when you talk about that, I say Nacho Health, AIATSIS, you know, trying to put everything else. Legal services, that's all, you know, legal services.
Yeah, well, the other part of that answer is what we talked about this morning around nation building. So if you're talking about barriers and enablers, we're really looking at the capability of First Nations, native title corporations and traditional owner corporations that are recognised as having this role and resourced to do it. That we have the network in place. People were talking this morning about needing to actually have that capacity to link with researchers. How do we, you know, we can create that. It doesn't take a lot, you know, for someone like AIATSIS to invest in that kind of thing. We talked about the ethics process as being an enabler as well as a barrier at times, and there's work we can do around that. I think the refresh of the targets for COAG is going to be an incredibly important point at which we bring this together. And I'm hoping that Ian Anderson will be able to talk about this tomorrow. I notice he's down to facilitate, but hopefully we can get him to talk a bit. But we are looking at Australian governments actually shifting their focus to have culture at the centre of their targets. What does that mean in terms of doing things different? They're looking at trying to come up with a conception of the targets that actually has culture at the centre, not economics. So the things that, and this has come out of, you know, the critiques of the Overcoming Disadvantage report and all of those things that have said we want strengths-based and we want you to actually focus on our identity and not on your conception about who we should be. If that gets across the line, and it's obviously a process of negotiation, that will change the game in terms of what kind of data they are looking for. And they're also looking at this idea of place-based prioritisation, which looks suspiciously like AIATSIS regional plans.
What does that mean?
Looks a lot like AIATSIS regional plans.
Can I? Sorry.
Yeah, sorry. I was just going to say, so those things are happening at the moment, and I think they create the opportunities to create an enabling environment that we probably haven't had in the last 10 years since the demise of AIATSIS.
This has been a fantastic discussion. We've only got, 5 minutes left. Should we allow the...
Yeah, get the floor. Get some questions, yeah.
Let's... Anybody got any contributions or questions, or should we let this wonderful panel continue?
There we go.
Okay, guys. Oh, yeah, sorry.
This is more of a comment than anything. Mark Finane, I'm a historian from Griffith University, and I've probably worked for 25 years or so on colonisation and incarceration. I've looked at a lot of legal records, and you're quite right, legal records are a fantastic resource for understanding a lot of the stories of this country. I just want to really endorse what Fiona and Lisa have both referred to about the kind of hidden stories that lie within archives, some of which have been recovered in the native title research. But I know from 25 years of looking at this stuff how many Aboriginal stories lie within the archives, waiting discovery, often uncovered by researchers who are looking at other questions. There's no systematic collection of these stories which people come across. There's no storing, but we are now at a stage with research infrastructure enabling, you know, federated collections. We have the wonderful Trove system. We have ways of making these things more discoverable, accessible and available for communities. And I think particularly listening to the presentations this morning on the three areas and the discussion about nation building, that I think it's at that local level particularly that there's tremendous resources in Australian archives awaiting discovery and will contribute to this. Thank you.
And I think a huge enabler is going to be to increase the capabilities of Aboriginal people. We have no excuse now. There are so many Aboriginal people who are, you know, students and PhDs and postdocs and so on. And we need to get that up.
If we get the design of the community-based portals right, so all the work that we've thought this morning about how communities actually manage that information at the local level and have their decision-making and governance structures in place. There's now the technology to have dual gateways where that material no longer belongs to the archive, it belongs to the community and is, you know, there are ways of actually setting up permission systems that allow Indigenous people to share what they want to share and close what they want to close, to get materials back from those archives. There's a great potential in the technology now that we've never had before for Indigenous people to actively recolonise their material in those archives and get it. And for me, it's really important to talk about archives as knowledge banks. It's not about getting the artefacts back necessarily or keeping the artefacts, and they are just objects. It's the knowledge they contain that's actually important, and if we can, that allows us much more freedom in terms of how we deal with the data as data, the knowledge as data.
And I think as with my researcher hat on, we often get very focused on the survey. Oh, can we measure it? Can we? What have you got in a box over there? Like, what have you got, right? And I think sometimes we forget what we're actually doing this for. And there's a wonderful phrase by, I think it's Professor Sir Mason Jury, correct me if I'm wrong, Liz and Tahu. What does it mean for Indigenous peoples to succeed as Indigenous? Right, and so this is the fundamental assertion of sovereignty, in that in order for the material in the archives to be meaningful, in order for the I won't say irrational, because it is properly anti-rational processes of government, to be sidestepped, and to have a conversation about what does Indigenous success mean? What does it mean for a Gomeroi child to be successful as Gomeroi? That means that the conversation about the data, the conversation about what it is that we do with it and how people get access to it, then has to be turned into something meaningful. And I think that talking about access and archives is one thing, but talking about translation is another, because that requires an army of suitably qualified people to translate that information into something that's usable.
I couldn't agree more, and I think that's a great note on which to end, and so let's thank our panel.